Okay, we'll do a countdown now, Trina. So 5, 4, 3, 2, 1.
Good morning, good afternoon, and good evening, wherever you are in the world. On behalf of UP-CIFAL Philippines, we welcome you to the class-organized webinar of the Professional Course on Global Migration, Spring Class 2021, entitled Migration in the New Normal, Global Perspective and Potential Directions Amid the COVID-19 Pandemic. My name is Angelo Zanturco Coletta, and I will be your host and moderator today. Before we start, let us hear a short message from the esteemed Director of UP-CIFAL Philippines, Honorable Dr. Edna Ko. Dr. Ko, the floor is yours.
Thank you very much, Angelo, for that kind introduction. I'd like to welcome again all of you, all those who have registered and who are watching us today. This particular seminar has been assembled, designed, engineered, put together, worked hard on by all members of the first ever professional course on global migration. We are very happy and we are very proud as well for the efforts that were put into by our 16 graduating members of the professional course on global migration. Our students and learners come from practically different continents of the world. Some come from Asia, others from Africa, from Latin America, from the Middle East, Europe, and of course, included in Asia are 3 participants who come from the Philippines. For today, this activity, which is considered as a culminating activity of all the learnings, will manifest to you and to everyone that there are 2 things that worry the whole world at this point. The first thing is pandemic, the COVID-19 pandemic, which is local, national, as well as transnational. And the other thing is mobility or migration. In this intersection of migration and the pandemic, there are a number of vectors or topics that our learners will present and discuss to you, including, for example, health, gender equality, social inclusion, which includes social protection, human rights, media, among others. And all of these things will be seen in light of how they interplay with each other in the context of mobility, migration, and the COVID-19 pandemic. While all of us are problematizing pandemic and the impact on migration and mobility, we don't want to get stuck into the problems alone, but as a matter of a challenge to redesigning and rethinking, our learners today will discuss to you what are the direction, what are the possibilities, what are the opportunities, and what are the perspectives to overcome this pandemic and develop a new normal. Given this, we still share and we still join the other international organizations in seeking for solutions and direction in the midst of all the obstacles that confront us. So, ladies and gentlemen, wherever you are, I am very pleased and I am very proud to present to you the discussion, the discourse, and the options and possibilities which our 16 participants of the course will offer to you. So thank you very much for joining us, and we hope that everyone stay on and learn from this interesting webinar. Good day.
Thank you, Dr. Ko, for such a wonderful introduction and a nourishing learning journey. The PCGM has shed light on all aspects of migration cycle, allowing all of us to better understand the challenges and opportunities migrants face. We want to extend our gratitude as well to the official partners of CIFAL Philippines, the University of the Philippines, the United Nations Institute for Training and Research, the International Organization for Migration in the Philippines, and University of Philippine Regent Honorable Angelo A. Jimenez. We would like to recognize our attendees from different parts of the world: Philippines, Brazil, Ecuador, India, United Kingdom, Germany, United States, Japan, Australia, and other parts in Latin America, Middle East, Africa, and Southeast Asia. This webinar attendees come from various sectors, including the UN system, government agencies, international organizations, not governmental organizations, the academy, and the private sector. More specifically, international organizations for migration, International Labor Organization, United Nations Development Program, and United Nations University, the Bureau of Immigration, Commission of Filipinos Overseas, Commission on Population and Development, Department of Foreign Affairs, Department of Health, Department of Social Welfare and Development, Overseas Worker Welfare Administration, Philippine Commission on Women, Philippine Overseas Employment Administration, Social Security System, Quezon City Local Government, and other government agencies involved in migration and development, as well as Red Cross, BLAS, Apple Policy Center, Philippine Migration Rights Watch, and other NGOs from the US and Middle East, as well as the University of the Philippine College, such as University of Philippine Population Institute, Miriam College, Polytechnic University of the Philippines, International Institute for Population Science, Tara Institute of Social Science, and other universities in the Philippines, and migration research think tanks from other parts of the world. Finally, the Philippines Association of Service Exporters and other international recruitment agencies. The COVID-19 pandemic halted a major socioeconomic activities and posed massive restriction to human mobility within countries and across borders. More than a year since the pandemic, some parts of the world began to open while others remain in lockdowns. As we move forward, migration is confronted with new challenges and opportunities in the new normal. In a moment of many uncertainties about the future, we, as practitioners, need to come to terms with the situation and overcome the crisis, understanding the life of migrants, their changing realities, and the adaptation measure of governments, while keeping in mind our commitment to fulfill and understand the Sustainable Development Goals and the Global Compact for safe, orderly, and regular migration objective. Today, we're going to focus on the challenges, opportunities, and way forward in relation to migration and the COVID-19 pandemic. Specifically, we will focus on 4 areas: migrant health and social protection, gender dimension, migrants inclusion and reintegration, and the role of media and communication. Today, we will hear from 8 presenters talking about these issues and how to transform these challenges into opportunities, analyzing facts through their regional experiences. We would like to remind everyone that questions will be entertained after all presentations. Kindly send your questions or comments through the Q&A button located at the bottom of your screen, and we will address them during the Q&A forum. For the first discussion, we have Mustafa Shakshak, Health Project Assistant in IOM Egypt, and Fahim Ferdoush, Counselor of Migrant Resources Center in Bangladesh for the International Center for Migration Policy Development, to discuss migrants' right to health, mental health, and social protection. Mustafa and Fahim, the floor is yours.
Many thanks, Angelo, for your introduction, and for Dr. Dana as well. So we're going to start first by migrants' right to health, mental health, and social protection. Okay, next, please. So if we're going to start by SDGs, sure, we're mainly going to focus over health, the first point or the first mandate coming over our head, starting by health, and target number 10 for reduce inequality within and among countries. Target 3 mainly focused over increased accessibility for HIV prevention, treatment, and care services for people are addicted or people who use drugs and the prisoners. Next, please. Key health aspects. COVID-19 now is like a part of the migratory cycle, which is reached or which is show vulnerability of 40 million people. All these people, main group of the or the I'm sorry. Among the group, including children, women, and LGBTI. Next, please. The key health aspects or the migratory cycle contain 4 points or 4 measures: origin, transit, destination, and return. Starting by origin, health system are very weak. The economic resource of families do not allow them to use or to able them to access a healthcare system. So it's like lacking them to use it. The transit at the border health system is due to high demand. As the people of arriving, and also the access of COVID-19 resource and to use any COVID tests and so on. For destination, lack of access, lack of reach to any service related to COVID-19, lack of resource, lack of governmental resource as well. And the last point, it will be return. It's related more for border closure, which is made migrants hard to back again for their own countries due to the COVID-19 and the effect have been from COVID-19. Next, please. The integration of migration into response to COVID-19. Some countries have granted the accessibility to healthcare system and COVID-19, such as Chile and Colombia and Peru. They are already included the healthcare system for their migrants. They deal with migrants now for healthcare system like any citizen in their countries. And WHO recently have built like 6 buildings. The main building to how to deal with migrants during COVID-19 and how it may affect later on. And it's very important to remove any obstacles to be able to match this criteria with the migrant later on. Next, please. Now, as we know and as we see around us, all migrants suffers from reduced remittances, their rights, and very hard to live now. And UN remind that migrants have to access healthcare system and to be treated like any citizen on the host countries. And as we see in this picture, next, please. So like a global look for the situation around us, we have 3 main points we have to address and identify: logistical, cultural, any barriers for migrants, both regular or irregular, might face, mitigate the shortage of nursing and the medical staff in COVID-19 or during COVID-19, and try to fill this gap, and address any circumstances happening during COVID-19, such as overcrowded in detention and any unsafe working condition, just to save life. And to keep in mind, this pandemic doesn't look at passport. And here in Egypt, in IOM, especially in IOM Egypt, we use and we have a slogan called healthy community, healthy migrant. If there is no healthy migrant, or if no any healthy community will be any, or won't be any health at all. Over to my colleague Fahim.
Thank you, Mustafa. Thank you, Angelo, for introducing me. And Assalamu alaikum and very good morning from the Bangladesh. I am Fahim Firdaus. I am working for the Migrant Research Center. And now I'm going to present about the mental health of migrants, which actually very disrupted and disputed because of this pandemic all over the world. And I will look after the why the migrants have been affected by for the mental health and what is the maybe the moving forward or the solution. Next slide, please. Okay, some of us may know, or maybe everyone know about what is the mental health. According to WHO, mental health is not just just absence of mental disorder or disabilities. People usually think that mental disabilities or mental disorders are actually the lacking of mental health. But the thing is, when WHO stated the definition of the health, actually, they stated three different kinds of things, like mental health, physical health, and social well-being. So if I want to read this actually about the WHO Constitution, states that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So according to this, the mental is a state of well-being in which an individual or a person or a group can realize his own abilities. He can do his find out his abilities, skill, and capacities, so that he can cope with the normal and daily stresses, like working stress, stress of students, stress of every working people or non-working people, and as a normal human people, and also can work productively. When a people affected by the mental health, actually the productivity of this person actually reduced due to his mental stress, depression, anxiety, or so many other disorders actually. And if people actually is very good with his mental state, he will make a contribution to her community. And when a people is actually not in a good state of mental health or social well-being, he will be not able to communicate, contribute, or produce anything to the community. Next slide, please. Yeah. So actually, this is a study for the 2020 during the pandemic actually, and we have gathered this data from the social media like Google Forms, like Microsoft Forms, and so many other. And there is some in one-to-one interviews too. So actually, why migrants have increased risk for mental health issue? There is a tough question, and this is a very relative question as we are going to present here. So first of all, when a migrant go for his destination country, there is absence of family care and social support. This is very common for every person, not just for the pandemic, but for every situation. When a person go out for another country, for another culture, another new perspective, a new situation, he actually feel the family care and social support around him. So social community and the family support is very crucial for every person, every individual. So when a person or a migrant actually feel this kind of absence, he actually gets some kind of disrupted in his mental health or her mental health. So there are some kind of gender-based violence issue in some countries, in destination countries. I will not mention any country's name due to some fact. So increased risk of this kind of abusive employers or trafficking. This also increase the disruption of the mental health of the migrants. So this is another issue, and there is a difficulty in delay and some kind of seeking asylum. For late 90s or 70s or 80s, the seeking asylum was very easy for some countries or in some countries, but now it shows some difficulties due to some new restriction, new situation, and of course about the COVID-19, there will be a term for the vaccination, the social distancing, and there is also the economical absence or economical disruption because of this pandemic. So migrant workers and refugees living and like congestion, camps, dormitories, informal overcrowding. There are so many other situation. If you can follow the UN report on this for the 2020, you will find a bigger picture from this. There is a language barrier, of course there is a language barrier. As far as I am from Bangladesh, I speak natively in Bengali, which is my mother tongue. But when I come to the Middle East or the Europe or the North America or like the Southeast Asia, So there is a lack of the language barrier. So there comes in the cultural differences, people's orientation, the food habits, so many things actually. So this also creates some, the depletion, the lacking of community support, and so many other things. So social inclusion is also very important in this part. WHO also said a paper on 2020 about this. So difficulty in accessing healthcare is so much difficult for some migrants. In some countries, the migrants are not allowed to the basic healthcare system of their countries. So this also creates some mental health state disruption. Next slide, please. Yeah. So there is a two figure. So why many migrants actually struggle to access to the healthcare. For the first figure, this is showing that how the respondents are not seeking medical health care for symptoms according to their education background. So if you can see the figure that those who have no schooling background is like 29.5%, who is not actually responding or seeking any medical health care for their destination countries. It's actually happened due to that they actually don't know what kind of medical health care, what kind of support they are going to able in their destination countries. And sometimes from migrants in Bangladesh particularly, I can say, people are less educated and going to abroad for more money or income thing. So they actually don't actually know what is in their contract paper. So actually they miss this kind of thing. There are primary education, there are secondary education, the higher education. So you can see there are those people who are more educated, they are going to take more medical care, but who is less educated, they are not actually seeking or responding. Okay. In the next figure, there is a respondent who are not seeking medical health care for symptoms according to the resident. If you see that who is citizen, he is actually going to medical health care. They are taking some kind of check up every 1 or 2 months later. They actually take good advice from the doctors, the dentists, and other people. So they can actually take a good care of their mental health as well as the social health and the physical health too. So if you can see that the no documented or undocumented people, which actually sometimes refers to as a illegal migrants, also don't care about the medical health care or the mental health care, because they're actually in a very unstable situation in the destination countries. So they actually care about their work permit or resident permit, some kind of this thing. So the health part or mental part is very absent in this part. Next slide, please. Yeah. So this figure is the pie chart. It shows actually the best symptom and the reason not seeking for the medical health care. So people actually think that medical health care or mental health care is so much costly in some countries. Yes, that's actually true. But people actually don't go to take care of their mental health because of their financial issues. Because if you can see, the big part of this crisis or the part is the mental health issue, that's showing the lack of financial issues. Then there is the fear of deportation, very much related, lack of availability of healthcare. Yes, in some countries there is a lack of healthcare too, and the entitlement of healthcare. There might be some restriction or very short access to their healthcare system for the migrants. They do not know where to find. Yeah, that's very very true. So information is very important for the migrants for this, not only this part but every part. In Bangladesh, we are working on this. So how to spread or how to disseminate information, the more accurate information among the migrants as well as the people, so that they can actually know what kind of access they have and what kind of services they can actually able to grab. And then there is a lack of transport in some countries, in like which countries actually feeling the war or kind of internal conflict. There is a lack of transportation. There are internal conflict like civil war and so other things. So there is this kind of thing. And don't speak the language. This is very much true. And I think this is one of the biggest issue. They actually cannot elaborate enough well about their issues, about their problems, about their sickness or the illness to the doctors in the destination country. As a language barrier, it is very hard to show that how I am feeling, what is actually troubling me, how is my mental state, and how I'm feeling and how I'm doing regularly. So this is another thing. So I think in this part, we have to look after the migrants so that they can take the test or take the training for the language, and it will be easy for them to access to some other services. And there you can also see some other thing like only if something goes worse, then they go to the doctor. Actually, it is very common in Bangladesh. So people actually don't much care about the healthcare. So they actually go to the doctor when it gets worse or even severe. But before that, they actually take a medicine from one or two. It's very common. And as a migrant in the destination country, it's very hard to take medicine without the prescription. So it will be showing that thing. Don't trust doctor or mental health workers. There are some kind, the stereotypes in the mind, and during as there are lack of education, it's also happened very common in some other countries too. I would self isolate, and I will take myself. I will take self care. This kind of stereotype also happen in mind in very common people. So afraid of getting infected at hospital from other people, and don't think the coronavirus is a bad. This is very common. People are not wearing masks, not maintaining social distancing, and that's the thing. The people from Bangladesh has been, uh, there's some other countries have actually closed their border or airplane from the Bangladesh due to the people's not understanding or people's actually not maintaining the social distancing. So the graph for the second wave for the COVID-19 in Bangladesh is rising so high before the Eid, if you can remember, for the very first of this month, but now it's reducing. And actually the other countries, I'm working with a migrant organization, and the other countries actually opening their border. Next slide, please.
Fahim, 5 minutes.
Yeah, thank you. In this chart, you will show the how can the mental disorders or mental health issues actually affecting the migrants. There are depressed people, the worried people, the anxieties, the loneliness. Loneliness is very common for the migrants. The anger, the reminders, the physical stress reactions like headache, like sweating, some kind of things. The irritability, hopelessness. It's very common that what will I do, what will be my future after these destination countries, and sleep problems. It's very common because of the new residents, new bed, some kind of this thing. And the last and not but least, the drug is very attached. So drug is not very common from the migrants in other countries, but sometimes it actually very easy to get them. So it's also mental problems for the people. And this is the chart that is showing that after the COVID-19 mental health, COVID-19 pandemic, according to their housing condition, it will actually also affect in any kind of mental health state to the migrants. Next, please. Okay, so if you can see this picture, there is the SARS COVID-19. So it will actually go right around the clock. So there is a global response like quarantine, like lockdown, physical distancing, lack of work, mask every time. And there is a conceptual framework actually, and there is a mental health distress. People actually feel about the anxiety. People, they are in the lockdown, staying home for like 2 to 3 months. Like in the Bangladesh, there are 2 months lockdown is still going on now. There is a depression, loneliness. People actually don't get much to know about their friends, not going to work. And some people actually lost their jobs due to the pandemic. And as well as the migrants are coming back from the destination country, and they are actually sitting in the house. When a person was the income source of the family or a community, he was like treated as a very good in every house. But when they are coming back from the destination country and waiting to go back around for 1 or 2 years, it's almost 2 years now for the COVID-19. So they are actually feeling very depressed and low anxiety about this. So when will the border again open? How will I work in the destination country again? This kind of thing actually troubling their mind very often. And the poor adherence to the prevalent measures like access to the information. This is very common. Like in the social media, there are some kind of the false news, the propaganda, some kind of other news. There is some kind of advertisement. People actually don't have any access to information. So we can look after about this information thing, access to the healthcare system and physical distancing. So this is the conceptual framework among the migrants about the mental health part. So this is the thing. Next slide, please. Yeah. So gaps about sorry. So gaps for the migrants in the mental health system. There is source of information about COVID-19 pandemic reported by participants. We take this study from the social media, like 72% of the research in Turkey for 2020 was from social media. There is a television channel, WhatsApp group, some kind of other things. I am very much thankful to the Mr. Dernegi, if I can spell this right. He done a exclusive and very important part of research, and this actually showed the information about COVID-19. So lack of information about where to receive the information, this is very much common, and 48% people actually responded to that. So lack of Turkish language skills. As a Turkey, in the settle in the Europe and the Asia part. So there is a language is a very good, a very tough and very limited aspect in this thing. And the lack of necessary means for the receiving information like TV or other things, they actually don't know what to collect the information and which one is right. Next slide, please. There's a age and gender gap in the mental health of part because when the part people actually get depressed very much between the 50 plus or the overall situation. And if you can see this is what the female are more affected by the migrants for the pandemic due to their families seeing some other part of the country maybe or the other part of the world maybe for the COVID-19, and they're not actually accessing to them, and they actually don't know what will be happen after this pandemic. How will their economical situation will be raised up again? So this actually affected the both male and female, but mostly female. If you can see the between the 18 to 49 age of years, the 71% female are actually impacted of the mental health group, and the 50 plus people is too much more 11% for 82%, and for the overall it's 75% people of the female, 75% of the female actually very much worried about this. How many time I have left, Kat? If you please.
You only have 1 minute left.
Okay, next slide, please. Yeah. Okay, so this is the moving forward part where I can see how two people actually responding. In Saudi Arabia, providing health insurance for migrants prior to their arrival is mandatory, and this is actually very much common in very other countries like Bahrain. They also issue some administrative circular, and in Bangladesh, the government made it mandatory for the outgoing migrants to have the rapid PCR test, which will define their status, and the Mediterranean migrants have the opportunity to take the vaccine from the government without any cost. This is very free for the migrants due to some regulation. And the Migrant Research Center Bangladesh, which I am working with, is a physical structure with multiple roles, and we're actually providing information, conduct one-to-one counseling and campaigns. So throughout this, we are actually through this disseminating the information to the migrants. So this kind of decision or the circular setting can actually help people or migrants to actually get disaster from the pandemic, and we hope the pandemic will be end soon. We will have a good new today, and we'll see the migrants are happy again. So I am going to Angela again, and thanks very much. Allah Hafiz.
Thank you, Mustafa and Fahim, for raising such relevant points amid the current situation. The role of government, NGOs, and other stakeholders is indeed crucial to facilitate and overcome the new challenges for migrants posed by the pandemic. We are now going to move forward with another fundamental aspect of migration, gender. Without further ado, I would like to call on Sandy Torres Chavez, an international and human rights lawyer, and Rowan Cinco, senior pre-departure orientation seminar trainer of Filipino Manpower Agencies accredited to Taiwan. Sandy?
Hello, good morning, good afternoon, and good evening to you all. Thank you so much for joining us tonight. I know we're being watched from all over the world, so thank you for taking the time to be with us today. And well, my name is Sandy Torres. I'm an international human rights attorney and an advocate for women's rights. And tonight, I'm going to be speaking about feminization of migration. So when we talk about feminization of migration, we're not really talking about recent phenomenon or recent development. No, we talk about something that it's been here for centuries, and more exactly since the beginning of civilization, since we as human beings, nomadic human beings, are start moving. But Kat, can you please help me with the next slide, please? The next two, actually. Thank you. All right, so when we are talking about feminization of migration, as I was saying, this is not a new or recent development. It's been years since story of humanity. But the difference is that nowadays, we as women, as migrant women, we have been taken in consideration within the phenomenon of migration. And so we are being more seen within the migration process. So when we're going to get later, we're going to talk about more about the numbers, as how many migrant women we represent in international international migrants. So, for instance, we have in the 1800s, when we talk about history, we were representing between the 20% and the 40% of international migrants. Currently, in 2020, last year, we were talking about a 48% of women population within the migrant international migrant community. So that tells us, how much participation we as migrant women have within this phenomenon. So when we talk about gender roles and inequality, I'm going to try to go as fast as I can because I understand I only have 10 minutes to talk about a topic that I love from the very inside, and it should be addressed by everyone in the society. So when we talk about gender roles, I'm going to try to skip gender, the concept of gender, as I consider everyone here is familiar with the concept. But when we talk about gender roles, this is a very sensitive topic, as gender perspective allow us to identify how gender influences people, families, institutions, and society at large. From there, we are able to observe what may be causing inequalities, as well as potential obstacles to equitable development. I'm so sorry. An understanding of gender and its impacts on every dimension of migration is necessary to unravel in the ways in which male and female migrant workers manage, navigate, and survive the many challenges of migration. Gender is a central organization principle of social life and permeates all social institutions. And it also affects migration patterns, processes, and outcomes while influencing government policies in migration and labor market segmentations, as well as access to rights, entitlement, and services. So when we talk about gender inequality, these can permeate the decision, the process, and it can severely impact the process of migration, as well as the networks and support systems that play a huge key role at all stages of migration. So I would like to, I'm not going to be able to answer these questions that I'm going to tell you, but I would like at some point to get these questions answered. And is the first one: how do we expect? How do the expectations, relationships, and hierarchies associated with being female or male affect the potential for international migration and process of migration itself? The second one is: how do gender inequalities in the societies of destination affect the experiences of migrant women and migrant men? The third one is: to what extent and in what ways does migration benefit or disadvantage women and men? And four, what steps should be taken to ensure equal opportunities and outcomes for migrant women and migrant men? At this point, I'm not going to be able to answer that, but I would like to have that, in the future from governments and society. Can we please move to the next one, Kat? Thank you. So when we talk about women migrating, so we have three things that I would like to address: reasons, numbers, vulnerables, and vulnerable sector. So when we talk about reasons, we're not really, we can assume that the motives and consequences of human mobility are shaped by various factors such as customary rules based on gender expectations, ethnicity, race, age, and class. And among these, it can be argued that gender has the biggest role and impact in the migration experiences for men, women, and the community of LGBTQ+. So, but when we talk about reasons, in my almost 10 years of experience as an immigrant, as a migrant advocate or advocate for migrant rights, I have never seen a man that is fleeing his country because he's being abused domestically, because he is being sexually tortured. I'm not saying nobody has gone through that, not male has gone through that, but I haven't seen that. So that is a huge difference when we talk about the reasons why women migrate, why they take the decisions, right? So that's a different factor that we should be addressing and we should be definitely talking about. So the participation of women in the migration process depends on the social roles of women, their autonomy, and their capacity to make decisions, their access to resources, and existing gender stratification in countries of origin and destination. Another thing that is a huge factor for women to migrate is the inequality and the human rights violations that they suffer within their countries of origin, and that force them to leave. But also as men, just the same thing as men, we also migrate because we want to pursue our goals. We want to increase our economy, because we want to help our loved ones, because we want to help our family that was left behind. So we also should be considered as part of this process, and consider that we're not only migrating, because I forgot to mention this, but before the 80s, women were considered that they were only migrating because we were accompanying our partners, right? Because we were just part of the family, and then because we didn't want to separate the family, so we will reunify with our family in the country of destination. But that is part of truth, yes, but it's not the whole truth. So we should also consider that women migrate because of our own decisions, because we want to improve our lives and because we want to help our loved ones, and it should be taken in consideration and it should be recognized. When we talk about numbers, it is very interesting because right now in 2021, according to the study that the International Organization for Migration provided in 2020, we saw that we are almost 50% of the international migration population. So we are 48%, and that is almost half of the migrant population. We can see here in these little charts that I am presenting to you that actually in some places, women are the majority of migrants. We have, for example, Europe with 51.6%. We have North America with 51.8% that female represent the majority of migrants. For a little bit, just a little bit, but we do represent the majority of migrants. And we also should be talking about the vulnerable sector, the vulnerabilities of being a migrant woman. Can we move to the next one, please? Thank you so much. Not this one, but probably the next one, because I'm not going to have enough time. Thank you. So when we talk about vulnerabilities, we have gender stereotypical roles that influence the occupational categories for women. I would like to say something that to me, it was very like, I don't know, it really touched me when I read this. And the writer is Paranias. He said that the movement of women migrant workers is simply a movement from one unequal system to another where gender social roles are recreated and reproduced. So what he meant to say in this, I think so, is that contrary to the popular presumption that migration of women not necessarily or automatically lead to the greater freedom of movement and increased independence of empowerment, it actually in some situations, these do not empower, and these make women more vulnerable, and it doesn't really empower them because our sex, it increased, being women increase our vulnerabilities. And so instead of empowering us, it decreases our empowerment due to the lack of opportunities, due to the excessive vulnerabilities and the excessive human rights violation within the migration process. And something that I would like to address, because it's extremely important, is the human trafficking number that we present at this time. According to the UNODC, we can see that right now, 71% of the human trafficking population are women, including children, women, and adult women. 71% of the population. I'm not saying that the rest is not important, but we should definitely take a look into why is this happening and why women are more subject to these kind of vulnerabilities, like human trafficking, slavery, and prostitution, and or sexual work that is forced, right? And nobody is really addressing the problem. Can we move to the next one, please? I'm running out of time. So when we talk about, we're going to talk about public policies and human rights. And my next slides. So thank you. So when we talk about human rights, the human rights of migrants are among the least observed and respected rights, as reflected in the low number of ratifications for the Migrant Convention and the absence of a unified international mechanism to systematically address the issues and concerns of migrants. But when we talk about human rights of women, the protection gaps are exacerbate the situation, specifically when we're talking about women migrants. So a few examples of this is the difference of our work, what we do, how it's paid, our health access, our medical health access. We don't have the same protections. We have different needs, but we don't have the same protections. We don't have the same recognitions. So when it comes to human rights, we were talking about human trafficking. That is a huge violation of human rights that is not being addressed, that is not being covered, that is not being respected, that the governments are not creating public policies to protect, to recognize and protect women's human rights for women, migrant women specifically. And when we talk about labor, we can see that it's a huge gap, a huge difference between what men earn and what migrant women earn, and the kind of jobs that we can have access to. Women usually have access to lower income jobs or domestic jobs or caregivers jobs, and those are way less pay than when the kind of jobs that men does. But also when you have a migrant woman that is working within, for example, the construction field, and a man, even though they're doing the same work, we can see that they're being paid differently, just because their sex, just because of their gender roles, just because of the gender in the society. So that is a huge violation, not only of labor rights, but also by human rights, because it includes that. So can we move to the next one, please? Thank you. So when we talk about public policies, this should be a huge topic that all governments and social civil society should be talking about, because it is being proved. It is being proved that when you have a gender perspective, in the public policies, you can see the transformation and a real development of the society. So in many sectors of development, it has been, as I said, shown that working from a gender perspective increases the efficacy of policies and programs. Adopting a gender perspective means that programs should take into account the specific needs of women and men and should aim to shift on equal power relations to enable the full enjoyment of human rights for both sexes. So, as I said, it is being proven that we should be creating public policies with gender perspective, not only because the need of women, but because of the needs of non-binary gender, of non-binary people that identifies with a different gender that was assigned by the society. And when you create public policies without a gender perspective, you really limit what you can do for the society, what you can actually work with, because you're not included. So the good part about working with a gender perspective is that you include the less observed people, the less observed communities, the people that were more vulnerable, that were never taken in consideration. So when we work from a perspective that includes gender, this embraces all. We work all together, right? And it's been proven that it works, and it actually addresses needs that need to be addressed. So can we move to the next one so I can finalize? Okay, so when we talk about contributions of migrant women, so besides of all the contributions that we as women do with our families that were left behind, or with the families that we create in the country of destination, we talk about the social remittances and contribution to development, and the social and economic, of course, contribution to the destination of countries. It is being shown and it's being proved that women are the most that contribute to their country of origins, and all the remittances that they send to the country of origins are directly to their families, to the improvement of their families, so they can have a better life, and it's for the well-being. So and that is another thing, like a lot of their salary is destinated to the remittances that they're going to be sending to the country of origin, to their families. So we as women should be more taken into consideration in the process of the migration, the migration process, because we were not, in the past, we were not be taken as seriously as we is changing right now. So I'm a migrant woman, and I think that I contribute not only to my country of origin, but also to the country that I reside right now, with my job, with my experience, with everything that I contribute to the society. And it's not only me, it's also every single woman that is migrant, and that they are having a life in the country of destiny. So I think this will be my final presentation, and I'm going to be passing to my fellow Owen, that he will be talking about a specific case in the Philippines with migrant women. Thank you, Owen.
Thank you, Sandy, and warm greetings to everyone. The title of my presentation is The Crucible: Filipino Migrant Workers in the Shadow of COVID-19. Now, what I intend to impart through this presentation revolves on the following basic assertions. Next slide, please. First off, the Philippine economy is being sustained by the remittances sent by overseas Filipino workers. This may signify the permanency of the Filipino diaspora, which now increasingly bears a woman's face. Filipino overseas workers bore the brunt of the economic and social fallout of the COVID-19 pandemic. And lastly, today, the much abused rhetoric of OFWs, or overseas Filipino workers, as resilient heroes has simply become, I would say, irrelevant. Let me emphasize it that these old saviors are now the ones who need saving right now. Next slide. Allow me to initially amplify the realities behind these assertions by showing the following numbers as provided by the Philippine Statistics Authority. First off, of the 2.2 million overseas Filipino workers in 2019, 56% of them were female. 6 out of 10 of those overseas Filipino workers leaving daily are women, and 2 out of 5 of these women are domestic workers. Next, 7% of these women were in the age group 15 to 24, while 46.9% were aged 25 to 34. Therefore, We can say that female overseas Filipino workers were younger than their male counterparts. Lastly, personal remittances reached a whopping 33.5 billion US dollars, a record high which comprised 9.3% of the Philippines' gross domestic product or GDP. With COVID-19, however, there was a sharp drop in these remittances by approximately 840 million US dollars, and that was just from the period of March to June 2020. Next slide. These realities are further amplified by this chart. Now, you will notice that out of the 2.2 million overseas Filipino workers in 2019, almost half of them, or I would say roughly 800,000 of them, were involved in what we say, or what are called as elementary occupations, which I'm sure you know by now, simply refer to domestic work. Now, to illustrate the gendered impact of COVID-19, let me disclose some of the documented experiences of many Filipino migrant workers, particularly those involved in healthcare and domestic work during the height of the pandemic. Next slide. Let's start at the country of destination. First off, extended working hours in view of additional caring demands and educational responsibilities. Next, there was the reduced salaries and the ability to send remittances. Also, there was the increased possibility of job dismissals due to the employer's fear of contamination. Next, there was also the heightened risk of COVID-19 or contracting COVID-19, which of course can be attributed to the limited or practically non-existent access to social protections. And lastly, the increased risk of gender-based violence, both for those employed at the household level or those who have lost their employment. Next slide. Next, upon the workers' repatriation to the Philippines. Now, based on the research that I conducted, now there was somewhat limited, or if I may say challenged, coordination between the Philippine government and the destination countries in terms of facilitating the repatriation of overseas Filipino workers. Also, there were unnecessary delays on the part of domestic workers who are housed in the Philippine embassy. Now, in the case of these workers who ran away from abusive employers, now they require additional negotiations with the said employers. Now, given the closure of government offices, this situation complicated the issuance of documentary requirements for exit visas, severance pay, benefits, and the like. Lastly, there were also reports of discrimination being heaped against the returnees, which sadly further delayed reintegration with their families by at least a month. Lastly, and most noteworthy, we go to reintegration. Next slide. Upon reintegration, now there were instances of the risks of intimate partner violence being exacerbated due to the resulting strain on livelihood and income prospects. Also, there were somewhat difficulties or challenges attendant in availing government reintegration services and benefits. Okay, an example of this is the one you see on screen, the Balik Pinas, Balik Hanap Buhay program. And also, and this is quite noteworthy, even the Social Amelioration Program, or the SAP, due to a variety of factors, which are, of course, beyond the control of the concerned overseas Filipino worker. Next, we could also say that the reproductive and sexual health of the Filipino migrant worker was compromised precisely due to the limited access they have to health insurance and healthcare. And lastly, and I would like to put emphasis on this, there was the increased susceptibility to human trafficking and illegal recruitment. Given all these challenges, let me raise the question asked more than a century ago by Vladimir Lenin. What is to be done? Well, I've checked out numerous proposed interventions, and all of them I would say are very pragmatic, very realistic. And let me just cite some of them, particularly those suggested by the International Organization for Migration, the International Labor Organization, and UN Women, such as, next slide. First on the list, we have improved bilateral labor agreements. Now, hopefully, we're looking forward to future bilateral labor agreements incorporating healthcare provisions for migrant workers. Next, particularly for the host countries, hopefully they will provide assistance and social protection to migrant workers in a level and quality analogous or similar to their nationals. Also, constantly updated data and statistics. Now, this is critical. Now, what do I mean by this? Now, this is critical in the sense that to analyze and understand the gendered impacts of the COVID-19 pandemic, it requires the collection of comprehensive sex and age desegregated data and gender statistics, including those of female migrant workers. And lastly, although I would say this is somewhat obvious, but still let me reinforce it, ensure organized repatriation and return. Now, it is still worth noting that despite these challenges, these difficulties that were cited, there are emerging good practices. There are many promising points or positive points, which were, I would say, singled out by many I would say, stakeholders, many advocates, particularly those singled out by the Scalabrini Migration Center. Let me cite some of the center's, I would say, good patterns or good practices which it noted. Now, first on the list, we'll have recruitment or manning agencies being tapped increasingly as partners in the repatriation of overseas Filipino workers. Now, as enjoined by the Philippine Overseas Employment Administration, or the POEA, now recruitment or manning agencies are in fact required to closely monitor the situation of workers that they deploy and coordinate closely with the concerned Philippine Overseas Labor Office, or the POLO, for the extension of much needed assistance to these affected workers. We have to bear in mind that recruitment agencies, okay, are very much involved in the protection of workers. Also, online information campaign to support repatriated overseas Filipino workers. Examples of this are the Overseas Workers Welfare Administration's Quarantine Operations Facebook page, the website uwiana.owa.gov.ph, and the Department of Foreign Affairs Facebook page, OFW Help. And lastly, data collection. Relative to this is the Department of Labor and Employment's OFW Assistance Information System, or OASIS, which is a tracking system projected to provide appropriate government assistance to OFWs who lost their jobs. As individual migrant advocates, there are things that we can and should do to help cushion the gendered impact of COVID-19. Next slide. We can start by being responsive to the complaints of migrants, especially the women. Probe deeper. Watch out for the red flags, that is, indications of being subjected to gender-based violence, human trafficking, illegal recruitment, and the like. Make sure that you document everything, and above all, be vigilant at all times and report to the concerned authorities whenever the situation demands it. Filipino migrant workers have long been applauded as modern-day heroes. Right now, these heroes need all the help that they can get. Thank you for listening. And let me turn over the floor to my colleague, Noreen. Noreen, the floor is now yours.
Thank you, Owen and Sandy, for that broad discussion on the very important topic on migration and development. And the COVID-19 pandemic has actually impacted on both men and women differently, but increasing the vulnerability of women more. But so to speak, all is not lost, because there are opportunities in addressing the gender-related issues on migration. So to conclude this very important topic on surfacing gender in migration and development, I want you to note that each and every migrant story is very unique, special, and different. And it is for us as migrant advocates to let them tell their stories in their own way, and for us to be able to understand their stories and their experiences throughout their migration journey from their own perspectives. So let's watch the video. The COVID-19 pandemic has not only affected the key sectors of development, but has had an impact on migration and mobility. Lockdown measures have led to closure of economies and restricted movements of persons within and outside national borders. The COVID-19 pandemic has left communities and households vulnerable but more resilient to make livelihoods in these uncertain times. Meet Caro, a 29-year-old college graduate of tours and travel and cabin crew, a single parent from Nairobi, Kenya, who set out to the UAE 5 years ago in search of a better life for her and her family.
My name is Caroline Mwende. I'm 29 years old. My level of education is a diploma in tours and travel and cabin crew. I traveled back to United Arab Emirates in 2016 and I came back November 2020. I was working in the hospitality sector back in Dubai in a 5-star hotel for 5 years. The benefits that it has given me working back in Dubai was I was able to take my son to school. I was able to pay for his education policy, and I also was able to support my family and also my mom with her business. The experience that I have during the pandemic period abroad was so chaotic and hectic for us, being foreigners with the disease coming and spreading all over. You actually miss that you are in your country during those periods. My experience abroad during the pandemic period was so hectic and chaotic. Reasons being, some people were being terminated, and people who remained there worked a lot and long hours, and having a percentage of salary which was less compared to the other times. So it was a challenge even sending back money home. So another thing that happened during the pandemic was you miss your family back home. You don't know what's happening back home. So it really was a hard thing being in another country and waiting for maybe the corona to calm down so that you can come back home. Coming back to the country has been so challenging because of employment, because it's not easy to find a job when you're working outside there for 5 years. So sometimes when you go asking for a job, they will ask you the experience that you have back home. So it's so challenging. Our government should do more in assisting the migrants back there, because sometimes it's so challenging. We cannot invest back home because we cannot get loans from our bank. We really need our Kenyan government to consider the fact that it's not everyone who can have a title deed or can have a logbook to get loans. So it took me actually a very big decision in leaving my job because I had no option. Because they will not allow me to come for vacation. And so I decided to just resign so that I can come back home and see my family after 1 year, 7 months.
Cairo now assists her mother in the beauty and hair salon, a business that she helped develop when she was away. Though the proceeds are just enough to meet her family basic needs, it's not like before when she was in the UAE. Returnees like Cairo can benefit more from reintegration policies and programs set up by governments and other development partners, non-governmental organizations, which can offer vocational and skill training, entrepreneurial skills training, business management training, financial literacy. They can also benefit from welfare services that will offer psychosocial support, such as voluntary counseling for returnees and their families. The organizations can also partner with governments to offer grants and loans to diversify their products and services. Civil society should also create awareness and share information relevant to the migrants and returnees. This will mean that a whole of government and a whole of society approach is essential to increase the independence and self-reliance of citizens returning abroad for successful integration back to the society.
Thank you, Sandy and Rowan, for your presentation in what is an imperative aspect to analyzing migration movements. The importance of race awareness in vulnerable groups is a central pillar for governments, advocates, to review existing policies. And thank you, Noreen, for such a compelling video narrating the story of a returning migrant in Kenya. As we highlight the vulnerabilities surrounding health, particularly in mental health and gender, it is imperative to talk about social protection of migrants. We will welcome Mustafa Shakshak again to discuss this. Mustafa, the floor is yours again.
Many thanks, Angelo, for your efforts. So we are going to move to migrant and migration statistics over widely. So next, please. So we know all that migration is not new, and the statistics shows that by 27, the number reached to 258 millions, and in 2019, it's reached to 272. And just to highlight that migration is the main hand of development for every country. For example, here in Egypt and Syrian communities, and their efforts and their own business, which is contribute a lot in Egypt business and Egypt labor market. So they pay taxes, so they do a lot in their host country here in Egypt, and they have a lot of successful story here. Next, please. We have a lot of gaps in social protection. Like, for example, a lot of migrants do not have any accessibility for social protection, even if they are eligible, but due to administrative barriers, they can't do, rather than non-migrants or citizens. Also, as we know that a lot of migrants already contribute in pension or health insurance in their own countries, but while moving to any other country, they lost all these benefits, which made them ready or able to have a lot of risk since they lost all these benefits. Next, please. Also, next, please. Oh, so it's okay. Many countries have negotiated and still no agreement yet, or not like 100% agreement. So we still have like loopholes, and some countries exclude the social protection for migrants, even if they pay taxes or even they contribute with the host country. Next, please. Okay, so we have like a percentage from 33 to 49 of world population coverage by essential health service in 2017, which is like below the half. And we have some countries who applied the free access for social protection coverage for free, like Kazakhstan, Malaysia, for both regular and irregular, and Korea as well. And a very nice experience in Indonesia for something called rice ATMs for food accommodation like NFIs and so on. And recently, Portugal start to apply this as well. Next, please. So some regularity adjustment measure due to COVID-19, if it applied for all countries, it will help a lot for social protection for all migrants, such as extension of the validity of documents, not just like 3 months as what happened. And we see the validity of documents is like 2 months or 3 months, but by extended the validity for 1 year, for example, it will be like a great successful for them, as well as adjustment to migration process, elimination to fine, to waive this fine of documents, and temporary protection while needed. Next, please. So extending social protection to international migrants. Particularly, we know that migrants who being left out of this social protection are in risk, especially seasonal migrant workers for who come to work like for season and they back home again. And without any effective action to remove any obstacles, we won't meet the agenda of 2030. Next, please. Okay, now we have a real life situation in IOM Egypt. For an old man aged by 43, he is a single from Guinea. Due to political issues, he left his country and he came to Egypt. And due to a medical condition, he didn't work and he was dependent on some of his friends to just help him in basic life, basic life or his basic daily needs. And upon screened by IOM physician and doctors, and during health assessment, he have been referred for a cardiologist who is wrote a report that he need an open heart surgery. And by time in IOM Egypt, he underwent an open heart surgery. This man was unable to walk or unable to work before. After he does his surgery and sponsored by IOM Egypt, he back again to work to contribute as a man or as a man or yes, like a worker again and back to his normal life, and he start to improve his quality of life. Many thanks, and over to my colleague Angela.
Thank you, Mustafa, for your valuable insights in migrant social protection. Extending social protection to international migrants is indeed fundamental to offer migrants a first start to thrive. To talk about the impacts of COVID-19 on social inclusion and reintegration governance of migrants, we now welcome Alexis Narim Bautista, Program Assistant in Migrant Forum in Asia, and Mumin Sisao, Senior Education Economies Officer of the African Development Bank Regional Office in Tunis.
Thank you, Angela. Good morning, good afternoon, and good evening, everyone. As mentioned, we will be discussing migrant inclusion, representation, and integration together with my colleague, Mumin Sisao. Next slide, please. To give you an overview, Mumin will discuss the socio-economic aspect, which include education and employment. Then I will be discussing the political aspects, such as what the governments are dealing with, what they have done, and policy recommendations. Mumin, you may proceed.
Okay, thank you, Alexis, for the flow. Yes, I'm going to talk about COVID-19 impact on social economic aspects, namely education and employment, particularly of migrants. Next slide, please. As you can imagine, COVID-19 pandemic has affected people regardless of the nationality, level of education, level of income, or gender. But the same has not been true for its consequences, which have hit the most vulnerable hardest. Let's start to highlight some key points regarding COVID-19 impact over the world. The COVID-19 has exacerbated traditional challenges effect on education sector, namely poverty, insecurity, quality of education, dropping out of school. School closure due to COVID-19 have widened the learning losses and the inequalities and hurt vulnerable children, students, and youth disproportionately over the world. Despite the great effort in supporting remote distance experience, school closure have resulted in learning loss due to unprepared teacher and administration to deliver distance learning, insufficiency of IT material or data connection. But in this context, we can note there is a global awareness and international cooperation to support education system facing COVID-19 bad impact. I mean, a global education coalition launched by UNESCO in 2020 and composed of 175 members, among which we have UN family, civil society organization, academia, and private sectors. Next slide, please. Regarding education, we can also highlight some key features as follow. More than 185 million children in Europe and Central Asia have been affected by school closure. Of these, 22 million are from countries living below the national poverty threshold. 12 million children miss up to 4 months of school across Burkina Faso, Mali, and Niger due to COVID-19 restriction in West Africa. COVID-19 also widened the gap of learning outcome between the 104 million learners from high-income countries and 59 million living in middle-income countries. Next slide, please. From that, we can highlight some key challenges as COVID-19 has shown the importance of technology in education sector, but there is a need to train and prepare teachers, school administration for distance learning to equip them with adaptive instructional material as they need. Learning losses, inequalities, and school dropout being significant resulted in lower qualification, depression of skill development for individuals with low socioeconomic background, increased income disparities over the world. Therefore, you can imagine that the goals of Agenda 2040 and the Global Compact for Migration can be threatened by these challenges. Next, please. COVID-19 has demonstrated the resilience and the versatility of some education system of the world. Here we can share the example of Finland. During the school closure, teaching and learning took place online immediately in Finland. All students, including immigrants, were also given texts to learn independently or together with peers, and often hand in homework electronically to teachers. Students with immigrant background can also get their schoolwork by post. Good initiative in Finland. Also, we can mention that schools in Finland have been advised to consider the following aspects when arranging school work during COVID time. I mean, availability and accessibility of equipment, data connection, and material. Plans are made for organizing school meals in different situations for all students, including immigrant students. You can understand that this can contribute to reinforce the social cohesion between students. Next, please. In Finland, we can also notice that the government put in place student and staff welfare services, learning support, and the schools were ready to switch to distance learning if epidemiological situation requires. The national level recommendations were implemented locally, so there were very communication between the high level and the top and the down actors in Finland. Next, please. Next slide, please. Okay, here we would like to share with you a video sharing the Natalia's thought about COVID-19 impacts on education and employment. Please go ahead. Thank you.
What do you think, how this COVID-19 have affected your life or your family's life? What do you think?
Okay, actually there's probably quite much what it's affected actually, but maybe like the first I would say that this exactly Finnish language course probably was the first like thing which was some problem with that because usually when there's like normal times you don't need this like online anything. Usually they're just like normal courses. You're like going somewhere like to the school or to the some college kind of like part where these courses are going. But now since it was this corona everything, we had only this choice to be online, this course only online. There's like no other any option. So that was like the first thing. For the whole 6 months it was online all the time, and then like this diploma kind of documents we then received by the mail, like the normal post.
Yeah. So
because there couldn't be anything like celebrating or anything, or just like from hands to hands. No, just post by post.
Yeah, yeah.
Then what else? I would say maybe that in a way, for example, that this dentistry stuff that I have this kind of education, I have to start in Finland the legalization process of this dentistry if I want to continue to be a dentist here. Since I'm not from European Union countries, a bit more difficult. So I have to like with these documents quite much to do work, and I have to like pass to practice first, and then the exams of the dentistry, like the whole thinking. And maybe I would say that on that as well, this corona situation affected as well, because when it started, probably like work basically everywhere, if not stopped, at least it slowed down. So I think maybe I was waiting for my documents, for example, to be checked much longer than it could be in normal times, because there's not so many workers, wasn't so many like workers like as usual, who is checking this everything, for example. So
Yes.
it's a bit slowed down the process, even that as well.
Yeah. What about the employment? Have Corona affected your employment, and if in what ways?
What exactly maybe about employment, a bit difficult to say, because the problem is that I can't actually like do much with my work yet, unless if I will choose something like very different. because even if without corona, it still would be a problem, because I have to like pass the exams first and then only I can think about employment. So it's a bit like, maybe in this case it didn't affect so much yet, at least.
Okay. Thank you. We come back. In this video, as you heard, it's about Natalia Foff, about how COVID-19 pandemic affected a life, namely education and employment. As I've mentioned previously, the second socioeconomic aspect impacted by COVID-19 is migrant employment. Regarding this topic, we would like to share some key highlights. International Labour Organization estimates that we could lose between 5 million and 25 million jobs and see losses in the labor income in the range of 860 billion to 3.4 trillion US dollar. This is big. A large number of key workers on the front line in the pandemic response are migrants working in personal care, transportation, agriculture, and food processing. Therefore, they are most exposed to virus. The risk of infection is higher for migrants than it is for native-born citizens. And the employment rates among migrants has dropped since the virus outbreak. For example, in Spain, unemployment in the migrant population had risen to 25% by early September 2020. According to UN Refugee Agency and ILO joint study, remittances decreased by 8% in the Middle and East and Northern Africa region, and by 7.5% globally in 2021. We can also notice that the current crisis threatens push back the limited gain made on gender equality and exacerbate the feminization of poverty, vulnerability to violence, and women's equality participation in the labor force. Next slide, please. Regarding Finland example, we can mention that social distancing, self-isolation, and travel restriction have led to a reduced workforce across all economic sectors in the country and caused many jobs to be lost. There were 219,000 unemployed in March 2021. Many immigrants working in hotel, restaurant, and service or cleaning sector have lost their job, or their job have been temporarily suspended. Next slide, please. So, facing these challenging, we would like to make some recommendation that can be realistic. Strengthen the global education coalition, as I've mentioned previously, for more cooperation between countries in terms of sharing best practice, experience, tools to address the challenging of COVID-19. It is important to design and implement adaptive distance learning, taking into account local reality, facilitate the access to IT material, data connection, prepare teachers and administration in schools in order to enable them to implement learning recovery program with adaptive platform. It is important to integrate entrepreneurship and financial education in TVET program and match TVET program with labor market needs in terms of skill in the country of origin that can contribute to facilitate the reintegration when they return in the country. We also have to notice that it is important to promote gender-responsive solution as migrant women and men are not affected by the COVID-19 in the same way. Next slide, please. Next, please. Next. Okay, as you can notice, the crisis continues and its negative impact, notably in terms of employment, favor and falls, especially for the many recent arrivals. So it is urgent to prevent the pandemic from turning into an integration crisis. To do so, it is important to note some policy options as monitor the situation of immigrants and their children in health, employment, education sectors, ensure housing and employment conditions for migrants, respect sanitary norms in order to avoid spreading the virus of COVID-19. Make sure that economic and employment support measures to reach migrants, address the specific difficulties of children of immigrants in distance learning, provide immigrants with possibility to interact with native born outside of regular integration measures. These are some key highlights we would like to share with you regarding COVID-19 impact on education and employment. Thank you. Alexia, over to you, please.
Thanks, Momin. So, next slide, please. Many governments lost public support as they failed to take steps against COVID-19. On the other hand, some governments taking necessary steps become more popular in their country. The chart you see is from an article entitled "The Political Consequences of the COVID Pandemic, Lesson from Cross-Country Polling Data." The chart illustrates the percentage change in approval between February and July 2020, and it is ranked in descending order. Almost all the governments face different kinds of pressure to take different steps, especially in developing countries. Considering the necessity of livelihood. Even several governments face protests against their decision. One of the most discussed things in COVID-19 is vulnerable health care system, and migrants were the most suffered group of it. Such as many countries gave treatment to its citizens only. Even in the vaccination process, citizens are getting priority. Next slide, please. The pandemic fueled racism and xenophobia worldwide, especially anti-racism, were the most recorded case in this regard. As a result, the United Nations Secretary General Antonio Guterres said the pandemic continues to unleash a tsunami of hate and xenophobia, scapegoating, and scaremongering. Representation of COVID-19 as China virus or Wuhan virus made Chinese migrants more vulnerable, and migrants from China and other Asian countries were verbally assaulted in many destination countries. Such as on March 16, a group of young people broke the shop of a Chinese migrant, accusing him as a carrier of COVID. Next slide, please. A lot of the policies are taken in international migration, such as mandatory quarantine, COVID-19 tests of migrant workers, social distance in transportation, though all the measures were taken to ensure safety, but the migrants have to bear all the cost. In the time of COVID-19, Bangladeshi migrant workers who could not return to their destination country because flight suspension got loan from different microfinance organizations and banks. Migrants who could not return to their destination because of COVID are getting support from the government through social safety nets. Next slide, please. The pandemic is also a call to renew the commitment to the Sustainable Development Goals, ensuring that all young people have the opportunity to succeed at school and develop the knowledge, skills, attitudes, and value that will allow them to contribute to society is at the heart of the global agenda and education's promise to our future society. The current crisis has tested our ability to deal with large-scale disruptions. It is now up to us to build as its legacy a more resilient society. Next slide, please. From our perspective, inclusion, representation, and reintegration encompasses all of the SDGs, but allow me to just go through the goals which we think are directly related to it. Goal 3 is on good health and well-being, and we hope for migrants to be included in the universal health coverage. We also recommend that countries should strengthen their capacity, especially now during the pandemic crisis, and invest more on the design and implementation of the programs for migrants, even more so by migrants. Goal 4 is in quality education, and here we would like to see free, equitable, and quality education on COVID-19, its risks and procedures in their country, keeping in mind the assurance of equal access for all women and men. In relation to that, Goal 5 is on gender equality, and we hope that there is non-discrimination for migrants, especially women, and ensure their participation for leadership. Goal 8 talks about protecting the labor rights and working environments. We feel this is important to highlight given the precarious situations migrant workers are in. Next slide, please. Thank you. Goal 10 explicitly stipulates the empowerment and promotion of inclusion of all and reducing inequalities. Goal 16 talks about the inclusive and participatory decision-making at all levels and promoting non-discriminatory laws. We hope to see that in the country's programs and practices in response to the pandemic. Lastly, Goal 17 is about effective partnerships, and it is imperative that policies and programs on the inclusion, representation, and reintegration of migrants are drafted and designed with, if not by, the migrants. Next slide, please. When it comes to the Global Compact for safe, orderly, and regular migration, there are numerous objectives that aim to address these issues. Objective 16 seeks to empower these individuals and societies to realize full inclusion and social cohesion, while Objective 21 aims to facilitate the safe and dignified return and readmission, as well as sustainable reintegration of migrants. For now, we'll focus on two interconnected objectives that are largely relevant to the ongoing pandemic. Objective 4, which seeks to ensure that all migrants have proof of legal identity and adequate documentation, and Objective 15, which covers the provision of basic services to migrants. Next slide, please. The lack of adequate documentation has been one of the major barriers when it comes to the social inclusion and protection of migrants, especially for those who enter the country through irregular means, or those who are forced to leave their homes due to conflict, persecution, or natural disaster. Oftentimes, they cannot travel and work through legal channels, therefore making them vulnerable to exploitation, trafficking, and exclusion. This also makes it difficult for these people to prove their entitlement to nationality or to refugee status. Access to opportunities and essential public services become limited, and the reunification of displaced persons with their families become even more challenging. As I mentioned earlier, the lack of documentation also makes it difficult for migrants to access basic and essential services. In this case, an invisible wall has been put up that has blocked migrants, particularly those undocumented or in irregular situation, from accessing basic services. While lockdowns and other containment measures were designed to control the spread of the virus, in many cases, they inadvertently increased suffering among migrants. As you can see from the slide, because of these policies and restrictions, many migrants lost their jobs and livelihoods and were subsequently unable to meet their most basic needs. This led to worrying levels of food insecurity, homelessness due to their inability to pay rent, and worsening mental health conditions. Next slide, please. Some of the common barriers for migrants when it comes to accessing basic services, particularly during the pandemic, include exclusion based on residency or legal status, inaccessible information, financial barriers, insufficient or unavailable services, particularly in developing countries, fear, health, and safety concerns, lack of relevant documentation, and digital exclusion. I think one important lesson we could derive from this is that apart from the migrants, the inaccessibility of basic health services during a pandemic could also have devastating consequences to the destination country. For instance, an irregular migrant who is already exhibiting symptoms is unable to get himself tested due to the fear of deportation. He is also forced to report to work to be able to support their family's day to day expenses. He could then become super spreader and worsen the local situation. This kind of scenario emphasizes the importance of having an inclusive approach when it comes to handling pandemics. Next slide, please. Indeed, COVID-19 provided a serious impact on the social inclusion of migrants across the world. Apart from discrimination and xenophobia, the impact of the pandemic can be seen in the accessibility of basic services for migrant populations. Nevertheless, what we have to keep in mind is the exclusion of migrants undercuts the effectiveness of pandemic responses and lays the groundwork for more fragmented societies. Finally, what we have to remember is that these objectives, whether they are in the SDGs or in the GCM, are interrelated and encompassing. A comprehensive approach is needed to ensure that migrants are protected not only in the times of health crisis, but all the time. Thank you, and I would like to thank my group mates for their contribution, whom without would not be possible to make this presentation. So I'd like to thank Mark Gook, Imam Hassan, Susana Corey, and my co-presenter Mumin Sisao. Back to you, Angelo.
Thank you, Alexis and Mumin, for highlighting the socioeconomic and political aspect of inclusion and reintegration of migrants during a particular time such as the current one. We see indeed the need to create new paths to overcome the faced challenges. And thank you, Susanna, as well for sharing with us your conversations with Natalia, a migrant in Finland. We are now moving to our last presenters for today, Inmaculada Escribano and Musharraf Hossein, who are going to talk about the influence of media and communication during the COVID-19 pandemic. The floor is yours.
Thank you very much, Angelo, for your introduction. Thanks to the audience for watching. We're going to talk about media, but first of all, let me walk you through the main topics we're going to cover. We're going to cover how media is shaping migrants' perception, how migration is framing media, the stigmatization of migrants during COVID-19, and we're going to talk about a particular place, Bangladesh, where my colleague is from, and we choose also that country because they have a big amount of migrant workers. So first of all, how media is shaping the perception of migration. So most people have met migrants in their daily life through their work in the neighborhood. So maybe they are migrants themselves. So the perception of migration is based in through experience, but also media is a big source of information about migration that is impacting our beliefs, our perceptions, and our attitude. So how people act, what people think, how policymakers and agendas looks like, and the migrant decisions itself, they're highly influenced of media. Media are highly influencing them. So if media is highly influencing them, we need to think about how migrants are portrayed in media. So first of all, we can find there is a quite negative coverage of migration in media, but this is not only something that happened with the topic of migration. This is something that is all over the news. We might think that it is not only about for migration. It is all about all the news. And the thing is, good news seems not to make it into like big highlights. and bad news, conflict is something that is taking over the news. So this is not only for migration topics, it's all over the news. Next slide. Yeah, thank you. So how media is framing migration? So first of all, we need to look at the angle, and we see that many media in US and Europe are casting migration as an issue. So first of all, issue, conflict of law, order, or security, also dividing migrants from the native population and presenting them as a threat to the identity, social system, and culture. And here I have a little example from the place where I'm living. I live in China, Guangzhou, which is a city in the south. And we have here the biggest African population. In fact, the neighborhood where they live is called Little Africa. So for many, many years, Chinese media, they've been portraying them related to crime and security. And when you talk with many Chinese friends, if you told them that you are going to visit Little Africa, they will tell you don't go there. It might be very insecure, might be very dangerous. And if you ask them how they have created this image, they will answer, well, it's all over the news. I don't need to go there, right? So we can see how media is highly influencing the way we see migrants in our community. Next slide. This is another example. This is a recent news in Spain. As you know, 8,000 migrants crossed Morocco and entered Ceuta, which is a province in the north of Spain, in the north of Africa that belongs to Spain. And we have this title from the Libertad Digital, which is an online newspaper in Spain, which says Morocco has to pay for the invasion of illegal immigrants. So here we have this approach presenting the migration from Morocco as an invasion, calling to action to the Spanish, and creating a big fear. Plus, they are using the name of illegal immigrants, which we know that is completely wrong, as there is no illegal humans. Next slide. So language, how do we use the journalists and the storytellers? The language is very important because interpreting the facts through language is also shaping reality. And when we have a look to the main outlets and the reports, we can see that there is a quite a negative connotation while referring to migrants using a dehumanizing language. So presenting migration as a form of natural disaster, or migrants as animals or insects, which shows a totally detachment from of the journalists from the subjects. I don't like to call it subjects, from the people they are covering. Next slide. So here we have another example. This is another online newspaper from Spain, which says Morocco creates an avalanche of immigrants that strikes the government of Spain. Here we have one more time this use of avalanche, which is referring to like a disaster, climate disaster word, and is creating again this negative perspective of migrants coming to Spain. Next slide. Okay. We might think that this is only in online small newspapers, but actually this kind of approach or language, it is all over the news. And it also, we can see in the Spanish national broadcast, this is an example of the most watched news, a most watched channel in Spain, Antena 3, where we have this title where it says an immigrant saves a person. And we have also this other news where they show 9 immigrants and 70 people. This last report was quite interesting because these 9 immigrants, when they arrived with the boat to Spain, they just escaped. And they were also saying in the news that they were spreading coronavirus, which is quite strange because, I mean, if they didn't find them, how they know that they were spreading the coronavirus, and there were not much testing at that point. So it was like something that really didn't add much to the report, but we see there. Next slide. also to understand like how migrants are presented in media, we need to think about the platforms. So nowadays we are assisting to explosion of mediums, so many social media apps, formats, video, VR, which is changing as well how people is consuming the information. It's quite interesting that the US population, for instance, is getting their news mostly from the phones, 50% of them, which is bringing many challenges. Like, first of all, the difficulty of fact checking, because as we know, social media has a really fast pace and it's really hard to fact check all this news. Also, the lack of regulation can lead to more dehumanizing language, especially in the case of migrants and hate speech. But also it's bringing like many opportunities, as Nori, my colleague, said before. Like, it's also allowing access to migrants to create their own content, to become storytellers, and it has a quite low cost. Creating this platform is much easier than doing it in a traditional media, big newspaper, TV, which is bringing more diverse viewpoints. Next slide. Also something important, like how do we create this image of migrants in our minds? It doesn't only come from the news and information. Entertainment is having also a big impact in our image of migrants. So this report was talking about how the Spanish primetime fictional TV series are showing migrants are not really representing migrants. They are underrepresented, and also portraying them having less education, intelligence, or being more violent. So here another example. This is the other TV, the other private TV in Spain is Telecinco, which is the most watched, and that was a primetime TV series, which says interdiction to enter dogs and Chinese, which created a huge backlash. But I mean, it's quite unbelievable. We can see that in a primetime entertainment program. Next slide. So how all these narratives about migrants and migration are created in media, I think we need to consider the importance of the connection of media and politics. Media, even in democracy, they're getting a huge funding from political parties, and there are influence, so can contribute to certain narratives. Also important to watch out the new media that are being created by political parties, especially by extreme right political parties. We have also this example in Spain, where I come from. And then just very briefly, like the daily work in the newsroom, which contributes to publish the things that we have proved that they already work. Next slide. Okay, so also the media economics, the more and more media rely in freelance workers, gig economy, so that leaves the reporting into the hands of the freelance workers, which we don't have as many funds or resources to cover at depth report sometimes. So on one hand, maybe we can just fund ourselves, but with this lack of funding is really a challenge. Like, time costs money, and research, contextualize costs a lot of money. Next slide. Next slide, please. Okay, and just a brief mention to how also this explosion of new media is a platform for hate speech and fake news, which is creating that extreme political ideologies take root in online communities, echo chambers. We know that, like, Facebook and all these social media are run by algorithms, and they tend to reinforce the media we consume, like the news or the angle we consume, like through the people we already follow or the previous news we have watched before. So here, a question for the audience. I would like to ask you what we should do about all these fake news and how to regulate without falling into censorship. something to maybe we can debate later. Next slide. And moving forward to the case of COVID-19. So first of all, the epidemic of COVID-19, it was something unprecedented. Like many journalists didn't have training or experience covering such a event. So that was already a huge challenge. When the outbreak started, what I noticed, and also some reports noticed, is the use of language. Even before Donald Trump published his tweet on China virus, many media networks were portraying the pandemic, the coronavirus, as a Chinese virus. Also, the angle on the themes, I've been following how many medias were showcasing and selecting certain topics that I think didn't add much. For example, at the beginning, focusing in the dog consumption or the hygiene outbreak here in China. Even though this is something that exists, it is not representative. And I think it was really contributing to enhance this Asian hate and this violence against Chinese migrants. This is something that we saw in Spain. There was a quite like movement and violence against Chinese after all these news came up. And last is, yeah. So here a little example. This is the most reputed newspaper in Spain, is El País. It's really well known. And at the beginning, they also fell into that mistake. They were calling this new Chinese virus is contagious among humans. So again, one more time, they were calling coronavirus as a Chinese, as it has a passport. So I'm gonna leave you now with my colleague Mosharraf, who is a practitioner in Bangladesh, and he has so many amazing insights about how migrant workers experience this coronavirus in there. Thank you.
Thank you, Inma, and thank you everyone for staying with us. Good afternoon from Bangladesh. So my name is Mosharraf Hussain. I am a journalism graduate, and also like I have been working with the migrant worker for last around 4 years with the migrant worker. But another identity I have is like I am a member of a migrant community. My father is a migrant worker, and like around 90% of my male members of my family members are migrant worker. So this conversation is going to be like from a personal experience from the migrants' point of view, also from the practitioner point of view. So on 2020, last March, when the COVID-19 was spreading around the world, and as in Bangladesh, like we have this idea that it's a kind of like disease for the developed country. So it's not going to be like in our country. So like, but when we first detected the first COVID cases in Bangladesh, so it was like everyone was shocked, everyone was panicked. So as usual, the media and the government, they need an enemy to blame, because the government, especially the government, was so confident that yeah, COVID-19 cannot touch us. But when the COVID-19 arrived in Bangladesh, so they need a villain they need someone to blame on, and they blame on the migrant worker. Suddenly, overnight, migrant worker became like COVID-19 importer. They are considered as an outsider in their own country. So why we need to talk about this media stigmatization of migrant worker? Because from the last 1 year, what I have realized as a in my community, many of my relatives, most of my relatives, including my father, they were economically hit hard. They lost their job and everything. But what I did realize, after 1 year in surviving this pandemic, I have realized sometimes it's easy to recover from your economic loss, but it is very hard to recover from all the stigmatization, all the negative attitude towards you, all the discrimination towards you. So what the media in Bangladesh they did their coverage was somewhat so toxic about migrant worker, because once the migrant worker considered a hero in Bangladesh, and overnight they become a villain to the people of Bangladesh, because these media created this narrative that migrant worker imported COVID-19 to Bangladesh. Next slide, please. So, in response to like huge media reported, so like I said before, like on March when the first COVID cases were detected, and March 24, 2020, first person died from COVID-19. So yeah, the first person died, people were panicked actually. But what the media did, they reported that like the person who died, he was a relative of a Italy returned migrant worker. So again, it's like the narrative, because so it's like blaming the migrant worker because he returned from the Italy, and that's why his relative died. And this created like huge level of stigmatization of migrant workers. In response to this narrative, government started to like hosted a red flag on top of migrant worker house in their village, and also when they are returning from the abroad at airport, the government is stamping their hand like, yeah, he is a migrant worker. One of my personal experience I can share that one of my relative like came from also one of the Middle East countries, and he was like when one of our village leader was informed that he was coming on like next week. The village leader informed me like, no, you cannot allow this man in our village, because he was afraid that he will bring COVID-19 with him. But I assured him like that, yeah, he had tested, he will have all the negative COVID certificate, and because he's not going to bring like COVID virus with him. But suddenly all the villagers came to him and no, we cannot allow him in our area. So like suddenly like they become untouchable. And when I told my relative, that no, you cannot enter your village, and it was like one of the hardest conversation I have with him in recent years. Also in our area, like many tea stall even was refusing migrant worker serving tea, because it's like this narrative created huge panic, and it's like from all the media. Also like there were many incidents like government asked migrant worker to like quarantine, but the quarantine facilities was so unhealthy. So some migrant worker refused to stay in this quarantine house. Again, media without like blaming the system, because system was not prepared for this the huge for this pandemic, for the huge amount of return. But media started to like blaming migrant worker. Yeah, they are not want to like stay in the quarantine, but it's not that case. The case was like the quarantine facility was not ready for the migrant worker. So nobody like actually talked about the system or the policy makers. Everybody was like, they have a like easy like is target to like target, and it's our migrant worker. Next slide, please. So not just in a country, like also across the Middle East, Singapore and Malaysia, we have seen how the Bangladeshi migrant worker on all other migrant workers, they were like stigmatized. There was many xenophobic sentiment about them, like migrant workers. Their countries, including Bangladesh, Philippines, and they were labeled as like they are from a backward country, so they live in an unhealthy environment, so they are like spreading COVID-19 virus. Again, they are not living in that unhealthy environment. It's the like employer, it's the company who is to blame, because they create this environment of unhealthy amount. So it's not the migrant worker who is to blame. But again, the media and all the celebrity or media personalities blame migrant worker. Even in a case in Italy, like migrant worker from Bangladesh were considered as like the viral bomb, because there was coronavirus certificate scam in Bangladesh. So it's not like the migrant workers' fault because there was a like fake coronavirus certificate. It's the, again the people from the like power government or any, they were corrupted. So but the blame was on our migrant worker, because like they are bringing COVID-19. So like media could play a positive role here, but they never looked into the in the deep into the subject. Next slide, please. So one of the interesting things happened in Malaysia when the Malaysian government was deporting large number of irregular migrant workers, and they were arresting from the dormitory. So one of in one of the Al Jazeera documentary, one of the Bangladeshi migrant workers was they appear he was interviewed, and later he was deported. So it's another the government was was not ready for any kind of criticism. Also so after that documentary aired, we have seen that there was mass propaganda campaign against in the social media, in also Malaysian national media, against the Bangladeshi migrant worker, and especially against this Rahan COVID. But later, after the after a few months, when the situation started to get some normal, so as a citizen of Bangladesh and government, everyone see that Bangladeshi migrant workers were sending highest amount of remittance in recent decades. So suddenly overnight, migrant workers, those who are considered as a villain, now become their hero. So media again created this hero narrative of migrant workers. They were talking yeah, they are our remittance warrior. They are they are saving our economy. But this hero narrative overlooked all other discrimination against the migrant worker and their family leave behind, because we have this idea hero is someone super powerful, and hero is supposed to get beaten once in a while, and a hero can overcome all these things. But so when the government is introducing all the social safety net program and other program for the all the people who are affected in COVID-19, government forget the family migrant worker and the family left behind, because there is another general idea, because since migrant workers are sending large amount of money to Bangladesh, so people also people in the policymaker, they have yeah, migrant workers, so they are solvent, they have economically they are doing well. Since they are doing well, so we don't need to include them in the social safety net program. But that was not the case. Most of the migrant workers lost their job. They are actually sending their savings to save their family in Bangladesh. But it was temporary, because if we see in last few months, again, the remittances are declining. So this hero narrative of migrant worker also backfire towards the migrant worker. Next slide, please. So I have talked about all the problem here, but there is opportunities, and we can media is a powerful actor in policy making in any country. So it's it's supposed to it's easy to create a sensationalization by a viral story, but media is supposed to be fact-based, evidence-based, and it's not very hard to do that work. It's just, yeah, you need to focus on the story. So what do you as a member of migrant community, what do we want to see is we want to see the fact and evidence, and we also see human side of migrant worker. Again, the media needs to always remember that their words are powerful. They're reaching millions of people with a single report. So it's their words impacted people. When they use some racist or xenophobic terms in their reporting, it's hurt millions of people. So it's they need to little bit of careful about the choice of word, choice of choosing their angle. Since, yeah, we all know that this pandemic is it's not everyday story. It's maybe one in many decades. So it's everybody wants to go fast, go pick their story, but what we need is they need to little bit more careful with their story, with the choosing of word, with their and then need to the story should be ethical, consider all the ethical principles, avoiding all kind of stereotyping and all kind of xenophobic sentiment. Also, as we know, journalism should be fact-based and evidence-based, and also migration is not all about like data, all about number. There is a human side of migrant worker. There is a real people working abroad, working in the like 50 or 60 under the 60-degree sunlight, working in the construction sector, working in the driving sector, in the across work. So they are real human. So when we are producing a report, when we are producing a news, we need to like keep in mind that like we're talking about real people. When we talk about like even a family of migrant worker, so it's like we are talking about real human being. So like after like COVID-19 will end, and this have teach us that during any kind of crisis, especially during any kind of crisis journalism, it should be like we need to like more focus on with our wording, with our angle, with our like what we are talking about. Like we need to rethink about that. Also, like another thing, government and all the stakeholders, especially the NGO, can do is empower migrant workers with information. Because if they have access to information and if they have enough media literacy, they can be their own voice. They can be act like a citizen journalist. So in social media, they can like use those media as like if more effectively. So that they can challenge all the xenophobic and toxic narrative about migrant worker and their family. So yeah, that's all from my side. And thank you for listening to us, and thank you for staying till the end. And if you have any question, like throw them in the chat box. Thank you everyone again.
Thank you, Immaculada and Mosharraf, for your presentation. Media has played a major role during the pandemic. We have seen the consequences of fear in people's behaviors and policies, and how fake news easily spreads. The need of a positive approach coverage is indisputable. Thank you again. We have some questions and we're going to go through them now. We're going to start with the first one we got, and this is a clarification. It was mentioned that 7% of Filipinos who migrated are aged 15 to 24 years old. How were the underage able to travel outside for employment? Owen, if you want to answer that, please.
Okay, thank you very much, Angelo, for that question. And also thank you to Camille. I understand she was the one who raised that question. Okay, well, yes, admittedly, there are overseas Filipino workers which fall within that age bracket, surprisingly, particularly the age of 15, 16, 17, and 18. Now, although these are particularly the ages of 15 to 17, although these are below, I would say, the age of majority, at least here in the Philippines, there are still workers in that age bracket who manage to go abroad to work. And why is that? Now, this may be sad to admit, but there are some recruitment agencies who tend to, I would say, for lack of a better term here, they tend to take advantage of the desire of some Filipinos to go abroad and work, despite the fact that they are not of majority age, which is a very basic requirement. Okay, because in the first place, you should be at least at the age of majority before you can sign a contract, an employment contract for that matter. Now, in these scenarios, some, I would say, unscrupulous recruiters, they are in cahoots with other people, with other forces, to the point that they falsify the birth certificates, the documents of these workers to make them appear that they are of legal age. So that's the answer there. That's the sad, unfortunate, and yet direct answer. There are officials, there are people who have the authority and the capability to falsify the documents, the travel documents of these workers to make them appear that they are of legal age. So and the difficulty is it's late that these workers are eventually discovered as having these falsified documents. They are finally discovered as having these documents only, or particularly in those instances when they find themselves in hot water, meaning they are, say, abused by their employers, maltreated by their suffering inhuman working conditions. So they are very susceptible to employer maltreatment abroad and even human trafficking. So when they return to the Philippines, it's only then that the government finds out that they are in fact below the age of majority. So that explains why.
Thank you, Owen. And I think we're staying with you for our next question, which is what does unnecessary delay in repatriation of undocumented domestic workers refers to?
Okay, now, particularly in the case of the Middle East, which is, I would say, the top destination region of many overseas Filipino workers. Now, when we talk about delays in repatriation, well, I have to emphasize the fact that when we say repatriation, this is not something that immediately happened. Displacement does not lead to immediate repatriation. Why? Because they had to follow an exit process, a step-by-step exit process, which is required by the destination or the host country before they could actually go back to the Philippines. Now, in the case of, for example, workers who ran away from their abusive employers, now the situation is further complicated. Okay, why is this? Because in the first place, the Philippine embassy has to negotiate further with their previous employers, the employers they ran away from. Okay, so that will complicate the matter. Also, they have to be cleared with outstanding bills or whose residency permits have expired. Now, given the closure of many government offices because of the pandemic, this complicated the issuance of documentary requirements for exit visas. Also, it is quite unfortunate that in this kind of environment, many overseas workers are not able to receive their severance pay, as well as expected gratuities and benefits at the end of year contracts. And also because of the screeching halt in commercial travel and closures of many international airports, Philippine authorities were left initially with no choice but to charter high-cost mercy flights, if only to bring our workers home.
Thank you, Owen. And since the time is limited, but there's another question for you as well, can we briefly go into what mechanisms can be implemented to strike a good balance between the needs of returning overseas Filipino workers with existing needs of the populations in resource-strapped countries or developed countries?
Okay, and I understand there's a follow-up question to that. So, what mechanisms can be implemented to strike a good balance between the needs of returning OFWs with existing needs of the population in resource-strapped countries or developing countries? Okay, I guess this is where the importance of improved bilateral labor agreements would come into play. As I cited a while back in my presentation, now one of the innovations or one of the proposed measures by the IOM, the ILO, and even UN Women is that future bilateral labor agreements should include, among other things, healthcare provisions. Okay, so however, in order this should be balanced in the sense that whatever healthcare, social protection is given to our migrant workers, or to migrant workers in general, all of these should be analogous or similar in terms of the level and the quality that the host country is giving to its nationals. Okay, so I know this is this may be quite demanding, but I do not see any reason why it cannot be implemented. It's a matter of political will, I would say, Angelo.
Thank you. And Owen, sorry that I stopped you there, but I want Alexis' insights on this question as well. Alexis, if you can add something to that.
Thanks, Angelo. On Lucy's question, so even if it does say safe, orderly, and regular migration, we always need to remember and reiterate, especially to governments or member states, that in the preamble, the very first thing that is stipulated in that is that the GCM rests on the purpose and principles of the Charter of the United Nations, and it rests on the Universal Declaration on Human Rights. And with that, the UDHR the human rights are universal, inalienable, indivisible, interdependent, and interrelated. So they're universal because everyone is born and possesses the same rights regardless of where they live, their gender or race, or their religious, cultural, or ethnic background. I understand that with the pandemic, our social movements are limited and we can mostly do online protests and posts, webinars even. But I think it's important to maximize that and work on this thing called multilateral approach by partnering with different stakeholders at different levels. So you may partner with, for example, trade unions, civil society organizations, the media, the lawyers, as well as in government, for example, local governments as well, not just in national level, but if you can also at the national or regional level. Thank you.
No, thank you. And Hassan, I'm going to refer to you for the next one. It's in the light of the global vaccination, will a vaccination certificate become a requirement for labeled migrants? And who will shoulder testing and vaccination in the event of this becoming a part of the work procedure?
Thank you. The question is whether the vaccination certificate is going to be a requirement for labor migration or not. Definitely, there is always a possibility that vaccination certificate can be a requirement, but till now, it's not requirement. Only the COVID test certificate is the requirement. And if it's become a requirement, then definitely there will be an international agreement required. And if government like countries wants to do an international agreement, then the government itself will be do the task regarding all the vaccination process and the agreement. I think you got the answer, Edwin Stroder. Thank you.
I know that we are almost running out of time, but I'm going to steal 5 minutes more from the attendees. And I'm going to pose a question for every group. So I will ask one member of the group to answer it, maybe in one sentence. So we have discussed how the COVID-19 pandemic has influenced not only our life in general and migrants' life in particular in different aspects. So the question will be, where are we going from here? What else is going to happen from now on? So I will kindly ask one member of each group to provide a sentence regarding the topic that we're discussing so we can close the webinar today.
If I could start, I think the most important thing would be partnerships. Again, going through that multilateral approach is important to make use of the networks that we have to advocate to the networks that we want to build with. Again, with a multilateral approach, whether it's the local level, individual level, or even at the national level.
Thank you, Alexis.
Yeah, I quite agree with Alexis actually in this here. And I will also add to the collaboration for the global perspective. There should be a global policy according to the COVID-19 pandemic, because, you know, it's not just for a region or a country like Bangladesh or a Philippines or like Venezuela, it's for the whole world. So there should be a global approach. There should be the existing policy and the development of the existing policy, and then there should be addressed the new normal and the new setting, and how the migrants should be, refers as in the destination country as well as the host country, and as well as is a pandemic, we should have to focus on the vaccination for the migrants too. Thank you.
Thank you for him.
So,
Musharraf, please.
Yeah. So like after post pandemic era, and we are going to like into the new era, and this era going to be like migration is going to be like, what I think is going to be like more skill-based migrant workers. So like in current situation, we have like a lot of unskilled migrant workers. But as we see, like the whole economical pattern and everything have kind of changed, and it's going to change more. So the migrant worker, for the future migrant worker, they need to, and we all need to like focus on developing their skill, which is like has real demand on the market. Thank you.
Thank you, Musharraf. Is there anyone else that wants to add something? Well, yeah, we are over time now, so I'm gonna wrap the webinar. Not before thanking CIFAL Philippines and partners, and of course all of you to attend it and to stay with us until the end. Thank you all and have a great day ahead. Thank you.